Hello. Hello, friends. Hello, friends. Yeah, dear colleagues. Can anyone tell me your audio or video are all okay, all good? Okay. Okay, great. So thank you for Qihuang assistant. Both are good. Okay, great. Thank you all to, colleagues, friends from all over the world to join today's Qihuang webinar. And we are talking about the brain acupuncture case studies. And we select the three typical cases on the brain diseases, including stroke, MS, and depression. I'm Professor Dr. Tianjun Wang from the UK. Okay. And in terms of my background, hope possible some participants are not so familiar with me, so I'd like to give you a very briefly introduction of my background. I first gained my bachelor degree in Chinese medicine acupuncture from Nanjing University of Chinese Medicine in 1989. After graduate, I worked as a medical doctor and acupuncture practitioner in a TCM hospital from 1989 to 2007. In total 18 years. And during these 18 years, I studied postgraduate acupuncture, and finally, I gained my PhD in acupuncture from Nanjing University of Chinese Medicine on the subject of acupuncture for depression. From end of 2007, I moved to the UK and joined the University of East London, shortly UEL, for 7 years. Then after that, I worked in my own clinic and also as the director of acupuncture course in the College of Naturopathic Medicine, UK. Currently, I am the principal of London Academy of Chinese Acupuncture, shortly LACA, and I am the director of my own practice as TJ Acupuncture and Brain Care Center. In addition, I am a guest professor at Nanjing University of Chinese Medicine. I'm one of the vice president of SCAP Acupuncture Committee of the World Federation of Chinese Medicine Societies. In addition, I am the president of Institute of SCAP Acupuncture UK. So that's it very briefly of my background. Hope for easy for you to understand. Okay. Okay, got it. Maybe some of you are aware my special subject about acupuncture for brain. This slide is a sample of my my work. In the end of 2020, just the first year of pandemic, I published my first English book called Acupuncture for Brain, Treatment for Neurological and Psychological Disorders, with in totally 100K words, published by one of the famous science and medicine publisher called Springer. This book, there are in totally two major parts. The part one is about the acupuncture for brain, the theory and the techniques, including the originally and developing of TCM acupuncture brain theory, the brain function, the related techniques, including scalp acupuncture and the Dumai Dao Qi technique, and of course, some research on the acupuncture for brain. The second part of the treatment of brain disorders. In this part, there are two major session, including acupuncture for neurological diseases and acupuncture for mental disorders. For the neurological disease, you can see on the screen, including stroke, Parkinson's disease, Alzheimer's disease, and the other dementias, multiple sclerosis, traumatic brain injuries, autism, cerebral palsy, epilepsy, headache, and pain associated with neurological disorders. So these are the sample diseases of neurological diseases treated by acupuncture. Each chapter including a basic introduction of this disease from the Western medicine subject, and of course the general introduction of this disease from the traditional Chinese medicine, the traditional acupuncture treatment, the unique brain acupuncture treatment, and acupuncture research on this area. The second the session of the treatment of disease, including some sample mental disorders such as depression, anxiety, bipolar disorders, post-traumatic stress disorder, TDSD, and insomnia, substance abuses. So this is briefly introduced of my book, and also the reason I like to introduce this the book highlight to let us a short review about the brain diseases, because today our subject is brain acupuncture case studies. What are the commonly diseases treated with acupuncture, with brain acupuncture? They are neurological diseases and also, of course, the mental disease. The neurological disease, the first example is stroke, and another example is the multiple sclerosis, shortly MS. Then the mental disease, including depression, etc. Depression is a typical sample. So that's the reason today I select these three diseases to introduce with colleagues. Okay, let's move on. Yeah, as you can see, today we are focused on these three major and commonly seen diseases in acupuncture, the subject, not only in China, but also in Western. On the right hand side, it's the scalp acupuncture area summary on the side to let you know some briefly picture of the brain acupuncture, scalp acupuncture areas. Now let's start from first disease called stroke. This case starts from a question called, can acupuncture treat stroke? The title first coming from on the right hand side, you can see a paper, article I published on an academic journal called Acupuncture. This is the title of the article, and why this question come from. And I understand that there are some Chinese colleagues from mainland China, and or some of them now they are working practice in Western countries. Maybe we all know in China this is not a question. Not only because of our acupuncture, every day we treat many stroke patients, but also for public, for Western doctors, for Chinese doctors, and the patient. Most of them are very familiar. They all understand, when someone, a friend suffering from stroke, they introduce them, refer them to see acupuncture. This is common sense, or acupuncture good for stroke. If any Western colleague has the opportunity to visit China to see a TCM hospital acupuncture department, they will see, so many stroke patients. Back to my memory, about 20-30 years ago, when I worked in an acupuncture department in China TCM hospital. In the outpatient department, in the acupuncture department, I would say roughly about 20% of our patients are stroke or stroke-related diseases. But in the inpatient department of acupuncture, normally about 1/3 or even half of the patients are stroke patients in China. So this is not a question in China. Can acupuncture treat stroke? Maybe our interests are more focused on how to improve the clinical efficacy of acupuncture treatment for stroke. There are lots of different style, different theory to help us to understand this treatment, this question. But in the Western countries, this is a question. And in this paper I published in, I say, 2008, I joined a conference called the ARRC, Acupuncture Resource Centers Symposies. On this the conference, Professor Nicola Robinson, she's a professor in the South Bank University of Acupuncture department. She presented the result of her survey called Acupuncture for Stroke, Perceptions and Possibilities. The talk attracted lots of interest discussion, including some colleagues asked, can acupuncture treat stroke? That's a question from, can acupuncture treat stroke? How does one treat stroke? Why do so few stroke patients in the Western present for acupuncture? Wherever in China it's used in, it's widespread. So during the discussion, these are old questions. Several colleagues said in their 10, 20 years practice, they have never treated even one stroke patient. So during this conference, I contributed my understanding of stroke, the treatment in China and how to treat stroke patients in general. So after I moved to the UK, I started to practice in the supervised student in the University of East London acupuncture clinic, because I am the director of the clinic. In total, there were 10 clinical supervisors. In the first 5-6 years, I only treated one stroke patient. And also the main reason of this patient come to see me was that that clinic was free of charge and treating clinic in the beginning, in some period. Sometimes I charge a very lower charge. So this situation began to change dramatically in 2014, the last year when I worked in university. One of the reasons was at the end of 2013, I was contacted by the wife of a stroke patient suffering from brainstem hemorrhage who had been in coma for 4 weeks. She contacted more than 10 acupuncturists through an online search, but no one agreed to help, etc. There's a long story. I will mention it later for the first case study. So after a total of 14 sessions treatment, give every other day, that means 3 times a week, the patient wake up and showed gradual improvement in memory, cognition, head and leg movements, speech, etc. Since then, I published this case on the journal. After this published case, a number of British Acupuncture Council members or other colleagues who read my paper for the case study have contacted me to refer stroke patients or patients with other brain-related conditions. Or lots of other colleagues contact me as well to gain some advices how to treat stroke patients. So this is something a start for my career to treating stroke patients in the Western countries. So now this is the first case, the acupuncture, scalp acupuncture for stroke patients. As I mentioned during the paper, the patient was a brainstem hemorrhage. It's partly of the stroke. We call the bleeding stroke or hemorrhage stroke. As you know, in stroke patients, in general speaking, there are 2 major parts of stroke. One is blockage, or called ischemic. That means one of the major arteries in the brain was blocked. And so the further brain areas has no oxygen and the blood supply, so the brain, the part of brain damaged. Or another part of stroke, what we call hemorrhage, or we call bleeding. That means that one of the artery broken. Then that means the broken bleeding give the actual pressure of the brain, part of the brain. So this patient is a brainstem hemorrhage. You can imagine brainstem, based on our general sense of the anatomy about neurological disease. The brainstem, we call it, is our center of life. The major important brain factors or controllers are all located in the brainstem, such as breathing, heart beating, and blood pressure, etc. So that means in this base brain center, if any damage, they may damage our lifestyle, our life. So in lots of studies, more than 80% of the patients who suffering brainstem hemorrhage will be die in hours or days. This guy, who was 31 years old, he was found on a toilet ground by a gym staff. He was in coma. So the gym staff called ambulance and sent this guy to an emergency department in a NHS hospital. He was diagnosed by the emergency CT scan as the brainstem hemorrhage. After a routine neurological treatment in the hospital, about 5 weeks, he was still in coma in the ICU of the emergency department. We call the intensive care unit. Because after 4 or 5 weeks, he was still in coma. So the family was told this patient would be die in any time, or by chance he will be in vegetable. If the patient was 70, 80, 90 years old, maybe the family just say, I'm sorry, I give up. But because he was just 31 years old, so the family did not give up. They searched if any help outside of the neurological medical care. Luckily, there is another doctor alongside the routine medical care called Google Doctor. They found in America there is another similar case with the brainstem hemorrhage, stroke, without good help by the medical doctors. Then the family sent the patient. It's similar. The guy was a bodybuilder. He was sent to China with the whole family in a China TCM hospital. In totally 3 months treatment, twice per day, the guy was much improved. And also luckily, that patient, his young brother, was a film director. He filmed the whole process and finally published a film called a documentary. Maybe some colleagues understand this documentary called The 9,000 Needles. Let's give the family a suggestion. Oh, acupuncture may help. So the family searched local acupuncturists, more than 10, but unfortunately, no one accepted they can treat the patient in the hospital as a coma. One reason they have said, oh, I have no knowledge and skill to treat brain patients. Oh, sometimes I'm very busy, I can't hospital treatment, etc., etc. But on another lucky, they contacted one Chinese doctor, Chinese practitioner. She said, I can't treat you as husband, as stroke, as a coma, but I know someone may help you. Because I joined a conference with Dr. Wang, I know he is a specialist on the neurological disease. So this colleague she gave my number to the family. The family contacted me. At the beginning, I was invited as a family friend to visit the guy in the ICU in the hospital. After my assessment, I said, based on my personal experiences and knowledge, I believe brain acupuncture may help your husband. With very positive. About 70–80% I said. The family was very happy, but unfortunately the hospital said, because I am not a registered doctor in the NHS system, I'm not allowed to treat a patient with coma in the ICU, emergency department. But the family member was very keen, very positive. They argued with the hospital several times. Then the hospital, the consultant of the ICU, Neurological, the consultant called me, made something like an online review, asked me more than 10 questions, such as my background, my education, my personal experiences with treating stroke, and the mechanism or possible reason why acupuncture help, and of course my insurance, etc. Finally, the consultant was happy for my questions. Then he signed the consent form, the first consent form as well. I start to treat the patient formally in hospital. In the base of every other day, I help this patient. As you can see, I used majorly we call the scalp acupuncture, and the other brain acupuncture, including the we say the 督脉导气 technique, and also maybe you know the special technique in China we call the 醒脑开窍, that means awake the brain and open auricles. I treat this guy with this acupuncture under about 10 sessions. Of course, during the process, the patient will gradually getting better. On the number 10 sessions, you can see the top picture. This patient, after my needle, the patient do 26 人中, he gradually raised his hand to locate the needle, hold the needle, and finally take the needle out. So, based on my experiences, that is a sign to indicate this patient wake up. Yeah. After this case, I wrote a case study and published on the journal called Acupuncture. We call it Acupuncture of Stroke case study. In this paper, I detailedly introduce the story, give the detail of my assessment, my treatment process, and finally some discussion. My major the conclusion or learning point for the members, that means acupuncture do help for stroke. Maybe some colleagues are not so familiar. That means we may find a supervisor or someone with more experiences to support. Then we can treat more patients, we can help more patients with severe cases such as stroke. Yeah. On the left-hand side, you can see this is my MOP, which is a clinical assessment called Measure Your Medical Outcome Profile, including their GCS called Glasgow Coma Scale for the patient process. You can see the whole process. Yeah, this is the first case study for the stroke. And I show you some of the typical scalp acupuncture areas I used in my the treatment for the patient, including sensory area, motor area, vasomotor area, speech area, etc., etc. Okay, next case study for stroke. Interesting was another brainstem stroke, but this one was quite gentle compared to the first patient. He suffered from brainstem infection. That means a blockage or ischemate. The patient was a male, 40 years old. He was suffering from brainstem infection 2 months. Then he was discharged by a local by the hospital, but still he has lots of symptoms such as vomiting, dizziness, balance disorder, double vision, etc. he tried, because this guy originally from, I think, Bulgaria, with some understanding of Chinese medicine or Chinese culture. They tried to find any acupuncture treatment, but a local acupuncturist said, I'm sorry, I can't help you for stroke. I have no knowledge. But I just read a paper from Dr. Wang. He may help you, but he's in London. Because this patient was from another city called Southampton, which was 3 to 4 hours drive. But this guy, his wife, contacted me. She said she can drive her husband to my clinic, although 3 to 4 hours drive on each way. Finally, we accepted. We booked this patient for my clinic. I majorly used the scalp acupuncture, such as the auditory area, balance area, vision area, and also applied some abdominal acupuncture treatment twice per week for 5 weeks. The result, in totally 10 sessions, the result you can see, completely no vomit. The vomit completely gone. And the dizziness, balance disorders, double vision, all improved in 95%. Almost gone. Yeah, this is another stroke patients you can see. And the areas I used just give you some brief idea, including this is the balance area, this is the vision area, and this is the we call the dizziness and the auditory area. Yeah, this is the areas, the major area I treat for this patient. And just maybe back. So you can see on this picture, this is the real picture I treat for the patient. Maybe you can see, and yeah, this is the you can see this is the auditory hearing area, or simply you call the hearing area, and these two are the balance area. So I treat this guy twice per week. One treatment on face up, another treatment face down. So I use 2 groups of the points. Yeah, this the and also you can see I combined with electric acupuncture for the guy. Yeah, and you can see this is of course the Google map. You can see he was originally from called Southampton, which is about let's say 200 something miles to my clinic in East London. So the driving on each way about 3 to 4 hours. In return, about 7 to 8 hours for this driving. You can say a whole day driving, and the treatment in my clinic about 30 minutes. So 7 to 8 hours driving for a treatment of 30 minutes. Yeah, but the both of them, they said they are happy. It's worth to travel. And after 3 years, this couple came to see me again for something else. The wife wrote a Google review. Can you say, we visited this clinic about 3 years ago for my husband to treat his stroke, balance problem. Dr. Wang treated my husband with scalp acupuncture for 2 months. At the end of treatment, my husband completely recovered, went back to work, and got his life back to work and his life back. Thank you, Dr. Wang. So this is the case. On one side, the family was happy for the treatment after this travel, and also this is a feedback after 3 years. That means after 3 years, he kept still very well. Yeah, this is the short review of a stroke patient. He's suffering from ischemic. The left hand side completely paralysis, palsy, 4 weeks. His left arm and leg 0, no any movement. I was invited to the hospital for the treatment, about 5 sessions, but because some family reason, he was removed to another country. But during the 5 treatment, some of the stroke-related symptoms are much better. Although the symptom itself, stroke, not much better during the 5 weeks, such as he's suffering a very severe depression. We all know for the stroke patients, most of them about 60–70% of them suffering from we call the post-stroke depression. That's a depression, the insomnia and the constipation. So during these 5 weeks, these symptoms are much better, much improved. I used the treatment. You can see I used the treatment, including intestine area, motor area, vasomotor area, and spread emotion area, etc. And the major area I used, as you know, is the motor area. You can see motor area, top point, lower point, divided by 5. The first part for the lower limb, middle part for the upper limb, the last part for the face, yeah, etc. And the next case is called charity acupuncture for stroke aphasia. That means the speech problem after stroke. I mentioned this case. There are 2 reasons. First reason is acupuncture good for this stroke aphasia. Secondly, I mentioned about charity acupuncture. What does it mean? So this was a female, 60 something. She was a council beneficiary. That means she has no job. She has not good income. She received benefit from the government. And also she suffered from breast cancer, female breast cancer, 5 years. She got a regular treatment with another local Western acupuncturist with free treatment. After she suffered a stroke and with the aphasia 6 months, but the stroke has not good response. So the local Western acupuncturist has no help for the stroke. Then she referred this patient to me. During the referral letter, she asked me, Dr. Wang, she is a council benefit receiver. I give her free treatment. Could you give her free treatment as well? She tried to ask me. She said, I know you are a professor, you are charged quite a lot than me, but could you give her treatment? I can't help her. So I said, yes, you give her free treatment, I can give her treatment as well for this the benefit receiver. So I give her charity acupuncture 10 sessions with free of charge. I told her, I give you 10 session treatment with free of charge. Yeah, a majority use scalp acupuncture. Of course, I use some body acupuncture as well. You can see we treat her at the beginning, first 2 weeks, twice a week, then weekly. In total, about 10 sessions. So majority I use the speech area, the first speech area, head area, and also plus some of the domain point, such as do 16, do 15. Some colleagues may be familiar with my the special treatment. I use a lot of domain Daoqi technique. Because I believe, and based on the TCM classic, domain is the channel of brain. So use lots of them. And also I use the Renmai 23 plus. Renmai 26 here is one treatment called Lianquan, but I use plus. It means 3 total needles, 1 middle, 1 side, and with Daoqi technique. Yeah, this patient after 10 session treatment fully recovered. She was very happy. Yeah, I mean charity acupuncture. As you know, in Western countries, our practitioners are almost all private setting. So we need maintaining our clinic, maintaining our income. So of course we are all charging as a private. But I believe after the first couple of years, we are beating for our life. We need our income. After a couple of years practice, we are all getting. I will say we are all getting the family, the job are very settled down. We are not at the start for beating our life. I think we can give back to our society for some lower income patients with some charity acupuncture. This is in my clinic. So in my clinic, we have some charity acupuncture, including some sessions of free of charge. Some patients, I read the proof of their benefit receiver letters. I give them 20%, 30%, or 50% of the charge. So that's my, we call the charity acupuncture. And I use the major, the scalp acupuncture area, including this is the first speech area, and this is we call the nose, throat area, nose, throat, mouth, tongue area, or we call head area for patients. This is the major area I just show you here. And this is the charity acupuncture for stroke patient. She wrote a feedback on my notes. So it was, exactly 8th of August 2017. She said, I has had a stroke and I have a cancerous tumor. Dr. Wang is treating me for the stroke at the moment. I received the employment support allowance. So Dr. Wang has given me several free treatment. Yeah, that's the first note. Yeah, first note. Then he said, I have made a good improvement since only have 4 sessions at treatment. 4 sessions has already, then my speech has come back to normal and my energy level has improved. Even my mood has improved as well. So you say, I'm thankful that Dr. Wang has given me this treatment. I'm definitely making good progress. So that is the patient with the, we call the stroke aphasia for the patient. Yeah. Okay. This is another stroke patients. I think, yeah, that's all for the stroke patients. Of course, as you know, I have many stroke patients in my clinic. As I mentioned, in the first 6 years, I worked in the university teaching clinic. I only treat 1 stroke patients. But now, at that moment, at the beginning, I thought maybe UK is a developed country. Their medical care are very high standard. Maybe there are less stroke patients compared to the other developing countries such as China. I thought, but after I started my specialist for the stroke patient, particularly for the first patient published the stroke case study, more and more patients come to see me. They either search my website or most of them referred by other acupuncturists. So now every year I have more than 10, even about 20 stroke patients come to see me in my clinic. Sometimes, occasionally, in a day, there are 2 or 3 stroke patients in my clinic. Of course, there are many other brain injury patients or brain cases as well. So now let's move on for the next brain case, brain neurological cases. We call it MS. MS, as you know, is a multiple sclerosis. This is, to be honest, for me, this is a completely new disease. Although I was the vice chief doctor in China, working 18 years in China in a acupuncture department, I don't think I remember I have treated any patient called multiple sclerosis. But after I moved to UK, I've seen more and more MS patients. I don't know why. After some thinking, I think there are several reasons maybe related for this, the differences. One reason is the diagnosis of disease, such as for depression patients. About 20, 30 years ago, in China, very few depression patients. But now they're not. One of the reasons at 20, 30 years ago, less doctors are awareness, and the patients as well. These patients are depression. For MS as well, because MS patients, there are very, very different symptoms at the beginning. They may be just one arm pain, one leg pain, headache, or tinnitus, vertigo, etc. They are very similar to other general pain disease or other muscular skeletal diseases. At the beginning, we don't know. Maybe they are not the first symptom. But with more understanding, so now in Western countries, I've seen many MS patients. Not only in my clinic, many of my colleagues, they have treated they use acupuncture or general herbal medicine to treat MS patients as well. Typically, I heard from one of my colleagues who work in a MS center. He said, he's a physio-acupuncturist. He said, in the UK, there are in total 54 MS centers in the UK. 54. In his center, the center he worked, there are in total about 500 registered MS patients. But of course, they are all day patients. They do not stay in the center. It's not like a hospital. They daily visit this center, get some treatment, including routine care treatment, physiotherapy, speech therapy, swimming treatment, and high oxygen, etc., etc. And also and with physio and acupuncture, but not a typical acupuncture, but they are more physio acupuncturists. One of the physio acupuncturists who learned scalp acupuncture with me in my clinic with my small group acupuncture, scalp acupuncture workshop, she loved. Okay, he loved scalp acupuncture. He sent feedback to me. He said after he has already practiced general acupuncture more than 30 years. He visited China several times with learned Western acupuncture and Chinese acupuncture. He said, generally speaking, acupuncture do help multiple sclerosis, but there are some room need to improve. For his experience, he said, particularly many MS patients suffering from the frequent urination. He tried general acupuncture, not good response. So he said, after I practice with scalp acupuncture, they are much better. General much better, particularly for the frequent urination. The area he used for treating the frequent urination is here. We call the foot motor sensory area. This area originally mostly treats the lower limb paralysis, movement problem, and the sensory problem, and upper back. But now it has been developed to treating many of the urological, the urination problem, male-female problem, etc. So after that, he invited me to provide the workshop in the center. First one for that was last summer, August last year. It was just opening a little bit of the pandemic. So that way you can see we all wear face masks. That was August. That was for English practitioners. 2 months later, we had another seminar in the center that was for Chinese practitioners only. So in total, we had 2 workshops in this MS center. Yeah. Yes, and yeah. Now I like to share 2 MS cases in my clinic. Case 1, it's a female GP doctor. As you know, GP doctor is a general practitioner, or in China we call them family doctor. She's suffering from MS 10 years. In the last 2 years, she was worse. Of course, the GP doctor, she got a lot of formal MS treatment, but not, but up and down. Generally speaking, getting worse. Her major symptoms are on the right arm pain and the weak leg, less balance. I majorly use the scalp acupuncture, and of course, I use some general acupuncture, some general, but majorly scalp acupuncture. Majorly, I use the foot motor sensory area, etc. Her pain was from 7 to 8 out of 10 to, in some months, 0. And then a little bit back to 2 to 4 out of 10. As you may know, if you got some knowledge of MS, MS has a wave trend. Normally, after 6 months, about 6 months, they may be getting much better and back again. So as a practitioner, we need to know this general trend to see some patients. if the patient with a very bottom line, they may, generally speaking, very, very good, but they may, in the next couple of weeks or months, they may up again. So we need to know this trend to explain to the patients, and not only treat them in the suffering wave, up wave, but also they need maintenance treatment during the baseline. That's it. The second case was a male suffering from MS 15 years. He's got general treatment by other practitioner. His main problem left come to see me because of the urination incontinence, the frequent urination. After the first treatment, he called me, Dr. Wang, you make me, you got a magic hand. And the same day, the night, he was a frequent urination several times per night. So you can imagine her sleep not deep, very superficial. So after treatment, on that day, he said, I had the best sleep in the last 10 years. Because she do not need any urination during the sleep. So much better. So you can see on this picture, this is the, we call foot motor sensory area. Yeah. And also, I can just show you some picture with the, for neurological diseases, I quite commonly, I plus electroacupuncture, EA means electroacupuncture, with scalp acupuncture on the head. I know some colleagues, in some book, they mentioned do not use scalp acupuncture on the head or do not cross the middle, etc. And I will say, in general speaking, it's true. We need to very carefully to use the electric acupuncture on head. But for the brain diseases, particularly for some severe brain diseases, we can use electric acupuncture plus scalp acupuncture on the scalp. They may generate a better result. So just give you some idea of this in my clinic. Okay, the final case study will be about depression. Depression is a typical sample of the psychological disease or mental disease. Nowadays, not only in China, but also not only in Western countries, but in China, it's getting much more now. The general practice of Western medicine doctors, they treat these patients. As you know, they are about they mostly use the we call it counseling. Counseling, as you know, it means they use the we call it, sometimes we call it the talking therapy or counseling or similar like this, or such as CBT, etc. And another major treatment is depression, particularly for the severe case. This young boy, who was 25 years old, he suffered from depression 5 years. Because of depression, he can't continue his university study. He left the university for 5 years. And he stayed at home. He has tried almost all the different treatment, including different type of antidepressant, but unfortunately, not good response. So he was in very severe time. Only he can stay at home. He can't work out without any help. He can't work out one step out of house without help. From picture, you can see it's really funny because you can see this treatment setting, not like in a clinic. You can see there is something like we call the tea table, and you can see here is something like a television. True. This patient, I treated the patient in the living room of his granddad. The reason is his grandfather suffering from dementia, and I was invited for the home visit for treat his granddad. His granddad getting better, and his mom asked me, "Can you treat depression for my son?" After some discussion, and I show his mother some of my published paper, his mom agreed for treat. But this guy was afraid of needles. He do not like needles. He refused at the beginning. But after several conversations, and he viewed my treatment for his granddad for acupuncture, he said, "Okay, now you can try me, but only one needle. I only let you try one needle. If it hurt, stop, no treatment. So you can think about it. If during the face-to-face class, I will ask the participant which points you will choose if you have this patient. Some colleague will say, oh, liver 3, heart 7, yin tang, do 20, etc., etc. But yes, I say, yeah, all these points are good for stress or early depression, but they are quite sensitive. It's not good for this boy, because if you're generally sensitive, the patient will refuse. So I choose the only first needle for this guy was Renmei 12, called Zhongwan. There are two reasons. First reason, this point on the abdominal area, soft and no pain, or less sensitive. Second reason, as you know, Renmei 12 is a point not only good for stomach and spleen, but also on the system of abdominal acupuncture. This point is good for the brain and head. So I use this point, treat this guy, put the first needle. He has even no any sensation. He said, okay, I'm ready. You can start the first needle. I said, oh, my needle is already in. He was surprised. Acupuncture can be no pain. So I continue treatment. You can see I use the scalp acupuncture, spirit immersion area, head area, and the stomach area. I use stomach area for him. Main reason, you can see also some point on the stomach. The main reason was he suffering from also obesity, because during the last 1 or 2 years, he only have a little bit of relaxed or happy was after a pack of chocolate. Every day he should eat a pack of chocolate, then generate a little bit of help, a little bit relax. So I treat him for obesity as well. So I treat this guy once per week. After a couple of sessions, he getting something better. One day he asked me, Dr. Wang, can I travel to Belgium, that means by fly, for a wedding? But my parents did not accept, did not agree with me. Do you think I'm able to travel? So after my assessment, I told him, yes, you are good to travel with fly, but of course with a companion of another friend. He joined the wedding by fly. Next week, when I saw him, he said, I'm very happy. I enjoyed the wedding very much. Thank you, Dr. Wang. He said, has never used this enjoy in the last 5 years. So that's depression. Yeah, and you can see I use the areas called spirit immersion area and foot motor sensory area. Yeah. Hopefully in the future I have the opportunity to explain to you why I use this, particularly for this foot motor sensory area for depression. Yeah, hopefully in the future. And give you another last case for depression. The main reason I give you for the acupuncture for depression, the frequency and duration. I got lots of questions, frequent asked questions for other colleagues when they're treating depression or other brain injury. You know, these problems mostly are chronic patients. How frequently you treat patient? How long you need last treatment and how duration and keep going? So I give you this sample to answer this question. I treat a female patient from her 20-something. Now she is 30. She was a teaching assistant in a local primary school. She tried to apply and test as a formal teacher. You know, the teacher and teaching assistant, very different level, and of course different payment, but all failed because she couldn't concentration for study. She suffered from depression 3 years with the lots of treatment, but always up and down. He was referred to see me. I treat her, twice, not this. Yeah, at the beginning, twice per week, then once per week, then once 2 weeks. In about 2 to 3 months, she getting much better. Then move on for once per week. Then once in 3 months, she back to normal life. And in total now, 4 years already. She only come to see me every 3 months. as you imagine, 3 months, that means 4 times per year. That's for mentally and physically maintenance. So keeping very well. She passed all the tests. Now she is a former teacher. She was very happy. And she came to continue to see me for maintenance every 3 months. Occasionally, if something happened, some stress, etc., she came to see me by some extra session. So let's give you some sample how to keep the frequency maintained. Yeah, last simple case for related for depression, we call the sleeping disorder. Generally speaking, acupuncture is good for sleeping disorder, but for some patients, particularly suffering chronic patients, they suffering sleep disorder a long period, then we can use scalp acupuncture. As you know, this is the spirit emotion area for treating sleeping disorders. This is another typical case. She is a practitioner. She joined my course in Ireland. She said, I come to see you directly for myself because she suffered from severe sleep disorder, insomnia, 40 years. Then I got the demonstrated treatment in the class. That was a 2-day course. I treated her on the same day, first day. The next day, she reported, Dr. Wang, thank you so much. I slept like a baby. It was the best sleep in my 40 years suffering. Yeah. Okay, because of time, I just give you some simple cases to introduce how to treat the brain diseases, typical disease, including stroke, multiple sclerosis, and depression. But of course, there are many brain diseases. Hopeful in the future, we have the opportunity to discuss with you. Looking forward, if you can join the Qihuang courses online, we have the opportunity to discuss. Okay, so that's the end for today, this free webinar. Hopefully you enjoy it. You can see my email and my Facebook. You are more than welcome to contact me through whatever email or my Facebook. And now I leave a couple minutes for some questions if you have none. Okay, let's see. Are there any questions? Yeah, so some colleagues they asked more points, instruction, and etc. As you know, today's webinar is not a formal course, just something like an introduction. Or next question, can I know where's the emotional area? Yeah. Sorry for today, I can't explain so much time for detail. I can just let you know the emotional area is in the front lobe. The front hair, because it's difficult to explain for this short webinar. Hopeful if you can join my other courses, including I think from the end of this month or next month, Qihuang Health will start online courses. We will discuss more detail about this location and points instruction, etc. Yeah. Thank you for your question. Okay. Yeah, I noticed. Yeah, I don't know if there are any other questions from the other group or from the Facebook group. Let's see if anyone else. Yeah, I leave a couple minutes for questions if you have. Let's see if I online. Oh, great. So Qihuang assistant said we have a group called Neurological on Facebook. Oh, great. You can search and join us. Yeah, great. You can, of course, you can join this Facebook as well. Okay, so now it's exact in the UK 4 o'clock. Oh, in China maybe now it's 11 o'clock now. Okay, so it's too late. Thank you very much for everybody who joined today free webinar. You are more than welcome to contact me myself through my website, my Facebook, and also you are more than welcome to join Neuro-Acupuncture for the we call the Neuro-Acupuncture on Facebook. Oh, someone asked explain the REMMAD 23 plus. Okay, REMMAD 23 you know, for in Chinese we call the 连拳 here. It's the one term below the qi here. You can use your thumb, this point here, on the direction about 45 degrees to the root of the tongue, with one needle. But we need Dao Qi technique. And simply, we said we need a slightly deep insert needle, roughly about 20 to 30 millimeter or 1 cun inside. And plus that means in China we call it qi ci. That means 2 other needles on the side of the REMMAD 23 lian quan. There's in total 3 needles, like this, 3 needles together to the root of the tongue, which can enhance the treatment for the speech problems. Yeah. I believe during the course we will explain more detail. Okay, now it's quite later now, so hopefully you enjoy the session, the seminar, and you are more than welcome to contact in the future. Thank you very much. Thank you, Qihuang Health, Qihuang Assistant. Thank you all the friends you joined today's seminar. Great, thank you very much. Bye bye. Where? Oh, here. Stop.